Welcome, everyone. Thank you for joining us for GLR Week 2025. Connect with the campaign for grade level reading on social media. On YouTube, subscribe to our channel at Grade Level Reading. On LinkedIn, Facebook, and Instagram, follow us at Campaign for GLR. And on X, follow us at Reading by Third. This week, we encourage you to use the hashtags GLR Week and hashtag Focus on the Gaps to share anything you learned from today's session, and we'll be sure to reshare. We encourage you to share any questions, reflections, and observations that you have on social media. Once again, I welcome all of you to today's webinar. My name is Sierra Sanchez, and I'll be helping behind the scenes to help produce the conversation. Before we get started, I wanted to take a moment to acknowledge our enterprise and programmatic funders, as well as our individual donors. Your support allows us to hold these vital conversations and helps us create meaningful opportunities to share insights, foster connections, and build the CGLR community. Thank you. I also wanted to give a special thanks to our Leo sustaining sponsors. Without you, we would not be here this GLR Week 2025, so I wanted to thank you again for your continued support. I also wanted to let all of you know about some housekeeping tips. First, we would love for you to introduce yourself. So please use the chat box at the bottom of the screen to share your name, city, or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here. And feel free to share your thoughts and insights throughout the duration of the webinar in the chat box. In the Q&A box, we encourage you to post any questions you might have throughout the conversation. We will dedicate the last portion of the webinar to respond to those questions, but our panelists will also be typing out answers throughout the whole conversation. The webinar is also being recorded and live streamed on Facebook. A link to the recording, as well as any slides, bios, and resources, will be shared in a follow-up email to all who registered. And it's not listed here, I apologize, but I did want to make you aware that we will have a poll that will pop up right towards the end of the session. We highly encourage you to respond, as this helps us with our commitment to continuous improvement. So again, I just wanted to take a minute to thank all of you for joining us on day 2 of GLR Week 2025. This week we have some incredible double features each day that will lift up and highlight several targeted big bet interventions and approaches that are helping to close the gaps and drive early school success for children in economically challenged families. On this slide, you can see the rest of the GLR Week sessions that we have coming up this week, including a few different opportunities on Wednesday and Thursday, and one happening later this afternoon. The registration links and more information for those sessions will be posted in the chat box now, and we hope you can join. And for the month of August, I just wanted to let you know that the GLR team will be taking a quick break from live webinars, but don't go too far, as we will be hosting multiple special rebroadcast sessions on our YouTube page. Here you can see the lineup of the sessions that we'll be featuring, and in the chat box as well, you can see the links to register for those special sessions. And in September, we'll be back to live sessions. On September 2nd, we'll be kicking off the continuation of our Beyond Decoding NAEP series, with this conversation focusing on the federal role in promoting efficacy, equity, and accountability. On September 9th, we'll have an exciting doubleheader, starting with a Crucible of Practice Salon at 12:30 p.m. On the 16th, we'll have another great funder to funder conversation on philanthropic support for child advocacy organizations and networks. And on the 30th, we'll have a peer exchange learning conversation. Again, more details to come, and those registration links will be posted in the chat box now, and we hope you can join us. And joining you now is Jenny Atkinson with the Campaign for Grade Level Reading. Thank you and enjoy.
Thanks, Sierra. And I'd like to welcome all of you to today's GLR Week session. It's great to see so many of you here. Our session is starting early to boost school success, state investments in early alignment and accountability. Since the inception of the Campaign for Grade Level Reading, we've seen how the fragmentation and non-alignment in systems and support for families with young children from prenatal to age 5 has contributed to the reality that many children do not start school ready to learn. The kindergarten entry gap is a product of this non-alignment. In recent years, the Campaign for Grade Level Reading has been lifting up the urgency of this problem and the need for systems to deliver more comprehensive and coordinated services in the right sequence and at the right dosage for the duration needed to close these gaps. We're delighted when we see states who understand this step up to take on better alignment of early childhood systems and put in place the kind of accountability that can lead to better choices for families and better outcomes for children. Today, we'll be joined by a panel of fantastic presenters who are all focused on alignment and accountability work in their respective states and communities. We'll hear from Lori Masur, Director of Early Learning with Read On Arizona, Marina Merrill, PhD, Director of Research and Strategy at Children's Institute in Oregon, Nasha Patel, Managing Director with Watershed Advisors in Louisiana, Jen Roberts, Chief Executive Officer at Agenda for Children in New Orleans, and Carrie Usevich, PhD, Executive Director at Early Childhood Action Strategy in Hawaii. You can read more about our presenters in the bio doc that I will post shortly. To lead our discussion today, we'll be joined by Stephanie Clothier, who serves as a director on the philanthropy team at Gary Community Ventures, directing activities in the school readiness outcome area. She develops and manages investments and solution strategies to promote school readiness in areas such as healthy births, children's early skills, and family support, as well as a portfolio around early learning focused on preschool and childcare. Prior to joining Gary, she was a senior policy director for Alliance for Early Success, providing strategic support to state and national organizations, and a program director with the National Conference of State Legislatures. So she's drawing on a wealth of experience as she guides us through this session. I'm so pleased to introduce our moderator. Welcome, Steph.
Thanks so much, Jenny. I'm so excited to be on this webinar and to be with the 4 states and New Orleans who are going to be presenting today. Again, I'm Stephanie Clothier. I work with Gary Community Ventures and I'm based in Colorado. We've been doing a lot of thinking about early alignment and accountability over the last 5 years, and I can't tell you how excited I am for the conversation we're going to have today as we think about how to tackle some of these really tough issues. We are going to start by hearing from Louisiana and their thoughtful, structural way they're approaching early alignment and integration of programs. Then we're going to hear from Oregon as they think about and share about their legislative effort and the momentum that that has created for them. And then we're going to hear from Arizona and Hawaii, who have these incredible collective impact efforts underway. And you'll hear some of the key sort of recipe ingredients that are critical to this kind of work. I was actually emailing with someone this morning who said, this is tough work, and it really is tough work. So I appreciate all of the interest in this topic as we think about how to do the best we can for children and families and really get the outcomes we're hoping for. So I have the great pleasure of sending the baton to Nasha Patel. And I just also want to thank her for being on this call and for all the work that she's done to support us in Colorado. And it's fun to see you presenting on the further progress in Louisiana. So Nasha, I'm sending it to you.
Thank you so much. Great. So I'm thrilled to get to talk a little bit about the work that I got to lead in Louisiana for a number of years. I'm obviously, as mentioned, no longer there. I work for Watershed Advisors as a managing director, leading our early childhood work. But the lessons I learned in leadership in Louisiana and with leaders like Jen Roberts, who's going to speak to the local side of this or the regional side of this work, I carry with me in my work with other states and have actually put together a framework, which I will link in the chat in a little bit to make available to you all as well. But yep, just to give you a brief introduction, my name is Nasha Patel. I'm a managing director at Watershed Advisors. I'll let Jen introduce herself too at the start here.
Hey everyone, Jen Roberts, CEO of Agenda for Children, and we're located in New Orleans.
Great. So as we come together to talk about early childhood systems, there's so much to say about the potential of state early childhood systems and the ways in which they have the opportunity to transform the lives of kids and families. But it's just a reality that in most states right now, the systems are not set up to execute on a clear, singular vision and plan to ensure that all families can access high quality early childhood options for their children. That typically can be traced to pretty significant fragmentation in funding, regulations, and program requirements that starts at the federal level and gets pulled down to the state level and then through localities, communities, and regional systems as well. But one of the things that all of the panelists on this call sort of agreed in preparation was important to say was, yes, the system is fragmented, but states can still lead. And I think that's the message that I hope folks take away from this conversation today. So we know that funding is the absolute greatest barrier to addressing access and quality gaps in early childhood. Full stop. We know that there is not enough money. This is an underfunded system. It doesn't pay teachers well. It doesn't support kids enough. Even when there are pockets of excellence, that is just not true at scale in any state. But building a unified early childhood system is essential work. It's essential work even in light of that funding not being available, to ensure that every dollar that is available can be used at its highest and best use, and make sure that we are continually making progress towards building an early childhood system that states, the federal government, localities, businesses, philanthropy can invest in. When we talk about this work at Watershed, some of the lessons that we learned in working in Louisiana as well as across other states is to sort of think about the system as a mixed delivery system, right? It's the default architecture of the system, regardless of whether you have mixed delivery preschool or all your preschool is in school buildings, or you have Head Start that gets offered across multiple settings, or Head Start is contained in one building. Families at the local and regional level and within their communities are accessing care and education through a mixed delivery system. And that's defined by these two components: the settings in which care and education is being offered, formal and informal, and the funding sources that are available to fund them. And, it would be easy if funding source and setting were exactly directly matched, or if this were the same in every community. The truth is it's not the same neighborhood to neighborhood, community to community, within a state, and then across states. The combinations of settings and fundings vary so dramatically. And these factors shape a complex portfolio of programs that often coexist rather than operate as one system. That makes it really hard to run. It makes it hard to make sure that your regulations make sense, that your funding streams are able to align, that you're able to use every resource at its highest level. And the result of those challenges means that administrative burdens fall heavily on providers and families. I won't go through this too much, but when we think about how to sort of tackle building a unified whole, a coherent whole for state early childhood systems, the lessons we learned in Louisiana was to think about it in these sort of buckets, to think about the ways in which you run state governance, to build state-local partnerships that empower those closest to kids and families to make the right set of decisions, and to build a coherent whole at the regional level, to ensure that your funding sources and funding structures across programs really cohere and can be reconciled against each other, to set a clear North Star for quality, to make sure that you're supporting that workforce to achieve it. Again, not sort of saying childcare workers here and pre-K workers here, but across the workforce whole. And then collecting ongoing implementation data. I don't mean waiting for kindergarten readiness assessment results or third grade reading outcomes, but as you're implementing each opportunity for change, coherence, alignment, collecting information about how it's going so you can make sure you understand how to increase your progress over time. And so we know that typical systems are disjointed. They're disjointed because of the way in which the system is set up to begin with. Funding comes from funders. It comes from the federal government. It comes from states. It comes from local taxes. And each time this funding comes into the system, it comes with its own set of requirements, maybe its own eligibility determination process for kids or for families, maybe its own definition of what quality is or minimum quality standards. That leads to a result on individual program administration, on administrators feeling like their role is to run the best possible version of the program that they have. And it passes down that complexity without being funded to families and providers. When we talk about coherent state systems, we say, let's flip it. Let's talk about the experience of kids and families, regardless of the funding stream that they are being served by. A 3-year-old is a 3-year-old is a 3-year-old. And our job is to create system-wide outcomes for kids and families and leverage the funding streams that are available to us to make that happen. That takes leadership, that takes structures, it takes a level of responsibility for reducing complexity and streamlining access, and ensuring that your leadership is not about will this get me in trouble with the feds? But it's more about how can I deliver on the promise of my state's system to the kids and families who most need it. That is hard. It's not easy. The system is not set up to make that happen. But that's what we tried to live up to in Louisiana, and worked in partnership with folks like Jen every day to achieve. So in Louisiana, we passed, I didn't pass this. The legislature passed something we called Act 3 all the time, even though after 2012 there were new Act 3s. We referred to it as Act 3 forever. That set up a local lead agency. It required somebody in every parish or county to coordinate across the system of publicly funded providers, to count all kids, to administer a unified quality rating and improvement system, and to coordinate enrollment, to make sure that to the greatest extent possible, families could go to one place, could submit applications for the choices for care and education that mattered to them, and they could submit their documentation in one time. And we thought about our work at the state government in these sort of levers. How do we pull the levers that are available in state government? Because we're not the legislature. We can't pass laws. We can't tell directors what to do. Providers run their own businesses to a certain extent. They have a lot of flexibility. So oftentimes people will say to me, you know, if you're not their boss, how do you tell them what to do? Well, you can't. But you can think about the ways in which, as a state leader, you have levers for change. Thinking about how you govern in a unified way. Where your regulations and guidance are conflicting or burdensome, how do you streamline them? How do you make sure that your funding is sort of matching your vision? You're putting your money where your mouth is. We created a simple quality rating and improvement system that focused on what we believed mattered most, adult-child interactions. And then we aligned every support and training resource we had to that system to really make progress. And we focused a lot on how we communicated to the field. So I'll let Jen talk a little bit more about the responsibilities of local leads and the ways in which they took on that level of coordination and coherence at the regional level to support the kids and families within their geographic boundaries. But it looked a lot like these 5 bullets with more added on when people felt innovative or had opportunities to do more. We really thought of these state-local partnerships as partnerships, right? I knew that I could not do the job of local leads, and they needed me to play a certain role to empower them to do the work that they were doing. They needed me to set the vision, be the one who was holding the system accountable, funding it where possible, and clearing the way for them to do the work that mattered most for the kids and families in their areas. And this is the slide I love to show the most because we started with a theory of what could be possible for kids. And if you look on the first map of like 2015, 2016, this shows our class scores, which was our simple quality rating system in 2015, 2016. And the University of Virginia helped us put this together. They did research on our system. By 2018, 2019, you can see how much of the map turned blue. Louisiana is a poor state. Resources are not equitably divided across all of these parishes, but you can see how much progress was made at a state level. And I really attribute this to the coherence of a state level approach and the persistence, dedication, and grit of our local leads to make it happen. And as a result of this work, if you can go to the next slide, one of the things that I think was really powerful for us was at a state level, we could count how many kids were being served through public funds in an unduplicated count. We could reflect the level of quality that they were experiencing, and we could use this information to advocate to our legislature, to our business communities, to advocates in the system, but also outside of the system for more funds to make sure that, you know, it's not just the kids that are in the seats right now, but how do we get to all kids and where do we most need that those resources. So I think the outcomes of that approach allowed us to build this kind of data and understanding that led to increased investment, more access for kids, and sort of a rising tide lifting all boats. And I'm going to pause now and turn it over to Jen to talk more about the New Orleans context.
Thanks so much, Nasha. If we could go advance in the slides, terrific. Nasha, do you want to do a plug for your framework?
I already did. You're right. I'm sorry.
Okay,
The framework is going to get dropped here, but it goes into more detail on how we think about this for other states. Thank you.
No problem. So hello, everyone. I'm Jen Roberts. I'm the CEO of Agenda for Children. Agenda for Children is about a 40-year-old nonprofit organization. We have been the child care resource and referral agency for our entire kind of history. But in addition to that, we also serve as one of the 64 community network lead agencies that Nasha mentioned. So we have one in every single parish that is responsible for doing a number of things, much of which is coordinating kind of government and funding and activity for and on behalf of the Louisiana Department of Education when you have this type of coordinated system. If you go to the next slide. So in this partnership that Nasha really referred to, it was and very much a partnership. I was probably on the phone with Nasha or her representatives in this role multiple times a week, where we would be kind of troubleshooting what we could do, or just asking in many cases how much flexibility we had. Because as you can imagine, when states typically stand up and say you have the flexibility to make determinations locally, sometimes that's just lip service. And in this case, it really wasn't. Nasha and her team at the department were really interested in ensuring that we could make decisions that made sense for Orleans Parish. And sometimes those didn't make sense for the other 63 parishes. What that meant for us is that we were responsible for administering funding for publicly funded seats. So we have around 6,000 seats now. At the time, in the earlier days, we were about 4,500, and because we've been increasing our access. We were also responsible for building the capacity and the quality improvement of those childcare centers. We did that both as the CCR&R, as well as being able to tap into new resources with state partnerships, because we served as this distinction as the network lead agency. We were also responsible for figuring out accountability and how to evaluate providers in alignment with the quality rating system that Nasha mentioned. And then also providing services directly to students, to families, to children, and to our partners who were working with children who had a variety of needs. So sometimes it was physical or emotional or social impairment, but sometimes it was just teachers needing more coaching in the classroom. And then also we partner directly with New Orleans Public Schools, which is our local school district, to help conduct coordinated enrollment and funding requests, which I'll get into in just a second. So I'm going to give you a really brief history. In 2012, Nasha mentioned Act 3 was passed, and what we had was a pilot year. So there were us and about, I think, 4 or 5 others that kind of volunteered and stood up on behalf of our parishes to say we are willing to take on some of these responsibilities to see how we can actually see if this will work, if this kind of systems approach at the state level will work. We became the first lead agency, and as part of that, we started conducting class observations twice a year, which means right now, still to this day, we're doing about 1,100 to 1,200 class observations annually. We also had to work with providers to design a common application. So that means that it didn't matter if you were applying for Head Start, if you were applying for childcare assistance, if you were applying for a state-funded seat or a locally funded seat, you have one application where you rank your choices. And then we also developed a quasi-governmental public board that would help be our advisory group so that all of these decisions would be documented in real time and open to the public. We were able to leverage that for about 5 years. And our grade level reading advocacy partners, I cannot stress this enough, the GLR coalition here in Orleans Parish pushed our municipal government for a local investment. So at that time, we were coordinating federal funding and state funding, but we did not have local funding. This was a major, major win. And in the first year, the mayor, with the approval of the city council, allocated about $750,000, which would fund 50 seats. In 2022, because we were able to leverage all of this experience, 5 years of public board meetings and decision-making processes and independent evaluations of that program, we actually passed a early childhood millage here in Orleans Parish, which is a 20-year mill. So a mill is a property tax. It invests over $21 million annually into childcare seats and services, and is eligible to be matched by the state and the legislature. This is a really, really big deal because now we are the largest per capita early care and education publicly funded program in the country. And we are the only one that focuses exclusively on infants and toddlers. We could not have leveraged it and gained voter confidence, gotten the politicians on board, gotten our business community on board, if it had not been for a good 5 to 7 years of documenting how we could coordinate the system locally with the confidence of our practitioners. And so I just mentioned the millage. This was a big deal. Again, I cannot understate the importance of our grade level reading campaign and advocates. Because we had the data from a pilot program and an evaluation, we had demonstrated community need because we had been documenting and conducting child censuses as required by the state twice a year. And we knew that we could potentially leverage this money against a state matching fund. We knew that we could expand by 1,000 seats, but it would actually be 2,000 seats. And so going from 50 seats to 2,000 seats in just 5 short years was nothing short of Herculean. I'm going to go to the next slide. So right now we are administering those seats. It's about 2,000. We are partnering directly with those seats for over 40 childcare centers across the city. They are located in all parts of the area. They are all high quality, but they all have room to grow, meaning both metaphorically and literally, right? So some of these are looking to expand facilities. Some of them are looking to improve their quality, but they are all willing to be part of this journey with us. We also provide, as part of that funding, wraparound support. So that includes teacher coaching, capacity building, parent case management systems. So we really modeled it on an original Head Start kind of model. And then we also have some funds in our first couple of years of this millage to support capacity building around facilities. And the facilities thing is key because we often think about advocacy in terms of quality and access. But in our case, we have essentially 8,000 kids that are eligible for this program that still can't take advantage of it, despite how much we were able to increase over time. And so I just have a few minutes left, but I do want to just show you, this is the growth of the program. And so if you just look at the blue and the yellow, which are the two kind of primary funding sources, the pink and the gray were really ARPA funds, you'll see how much we've been able to expand over time. And we are projecting a 6% growth again for our school year that starts on Friday. And then finally, just as I wrap up, we are this co-lead agency. Later on in the iteration, we really decided to bring in a second co-lead agency with us, which was the local school district, because they were so integral into ensuring that we could have a common enrollment system. And really, we wanted our leadership to reflect the contributions and the leadership that they were producing. But to this day, we still are responsible for coordinating all funding here locally in Orleans Parish, coordinating all of the enrollment and making improvements to that system. So it's been through several iterations based on feedback from providers and families. And now, as part of that, we've been able to leverage that state role into a local leadership role where we essentially are the school district for childcare that is publicly funded in Orleans Parish, which means we are engaging with all partners, all wraparound service agencies, all data systems, all communications, and everything that goes along with that. So thank you so much, and we'll answer any questions you have at the end.
Holy cow, that was incredible. Nasha, thank you so much. Jen, that was amazing to hear about New Orleans' progress. It's just really incredible. There are so many nuggets.
One thing just to add on to what Jen said. I
Great.
just want to note that when Jen talks about New Orleans Public Schools as a school district, it actually is a number of school districts that make up one. So when we talk about fragmentation, New Orleans is like such a good example to talk about and the complexity of that system because of the charter world that makes up New Orleans public schools. So I want to just name that, fragmentation exists and leadership is possible. And Jen's such a great example of that.
Fantastic. So look forward to digging in our conversation after all of our panelists, and appreciate all the audience reaction as well. So now I'm going to turn it over to Marina Merrill from the Children's Institute in Oregon to talk about their journey.
Thanks so much, Steph, and thank you to everyone for joining the conversation today. It's really great to be here. My name is Marina Merrill, and I'm the Director of Research and Strategy at Children's Institute. We are located in Portland, Oregon, and I am the co-state lead for the grade level reading campaign in Oregon, and we are in a very different place than Louisiana. But I'm going to kick things off by sharing a quick overview of two big policy lifts that we recently made in Oregon. Our new K-12 accountability legislation, Senate Bill 141, and the Early Literacy Success Initiative, because what's exciting about these policies and relevant to today's conversation is how these two efforts are working together in concert towards improved outcomes for young children. So we're not just investing in early literacy, we're also building out the systems and supports to ensure that those investments lead to real measurable progress through aligned funding, coaching, professional learning, and accountability in a way that is deeply grounded in equity and focused on improved student outcomes. So I just want to begin by grounding us a bit in Oregon's current education context. So as you'll see on the slide here, our most recent NAEP results in Oregon ranked us in the 48th in fourth grade math and 46th in fourth grade reading, so placing us near the bottom nationally. And even when adjusted for student demographics, Oregon ranked last in both fourth grade subjects. So you might be wondering, why is Oregon invited to this conversation? But these low scores really have persisted despite increased per student spending. And these data really pushed our governor to do something big and bold. And she focused on education accountability as a top priority in this last legislative session to move the needle on these numbers. So next slide. So Children's Institute, our organization, was honored to collaborate with the governor, our legislators, and cross-sector partners to advocate for Senate Bill 141, which won with bipartisan support in both chambers, and is really a much-needed opportunity for Oregon to meaningfully redesign our accountability system for our students. So for decades, Oregon's K-12 accountability system has been defined by these harmful and punitive federal efforts that have been aimed at improving standardized test scores singularly. And when that top-down accountability approach through No Child Left Behind dissolved, our state was left with an incoherent strategy that was fragmented and not focused on improving student learning. So the Oregon legislature has given the clear charge through Senate Bill 141 to build a new statewide K-12 accountability system that will help all of our 197 school districts continuously improve to better serve every student. And so just to be clear, during the legislative session, advocates really underscored that accountability can't just be about test scores, and underscored that it is about ensuring that every child has access to quality teaching and learning, because we know from the research that early academic challenges can become deeply entrenched. Even in the highest performing schools, we know that students can only typically make about 1.1 years of growth per year. And so if a child starts behind, it is incredibly hard to catch up later, as you all know. And so that's why acting early really matters. And it's when we have the greatest opportunity to make a difference. So at Children's Institute, we were really seeing a gap and concerned that our accountability system wasn't focused early enough or well aligned with our early learning system. So there was a real risk that these investments wouldn't be backed by the right structures to ensure the greatest impact. So we were grateful to and had the opportunity to shape the bill, and we did that grounded with community. We have partnered with over 17 school districts operating preschools to ensure that their programs are well aligned with kindergarten and beyond. And so we have firsthand experience and data that shows how critical that early alignment is. So we work to make sure that the bill included some upstream accountability measures. So things like performance targets, interim assessments, and clearer expectations for how our districts would use their early literacy funds that I'm going to talk about a little bit here in a minute. But really, ultimately, we were strongly focusing that this needs to be about alignment, making sure that funding, the supports, and accountability are all pulling in the same direction, starting from those earliest years. So this bill is our first opportunity to really lay out the foundation for continuous improvement and not just compliance. And it's really going to open the door to include these early learning metrics in our statewide accountability system for the first time. So next slide, please. All right, so I'm going to switch gears a little bit now and talk about the other policy, our early literacy bill. So prior to the accountability bill, SB 141 passing, Oregon made a huge push in literacy in 2023 and launched Oregon's Early Literacy Success Initiative. And the Early Literacy Success Initiative is a multi-pronged investment in literacy from birth through third grade. So it includes direct grants to school districts to strengthen kindergarten through third grade literacy instruction. It provides for community and tribal partnerships to address local literacy gaps, and a Birth to Five plan led by our Department of Early Learning and Care focused on culturally responsive, developmentally appropriate supports. And again, when the concept for the literacy bill was first introduced, we were encouraged, but that initial version that came out, it was clear that they were only thinking about early literacy beginning in preschool, which is better than not including preschool. But our policy and advocacy team worked tirelessly to shift that narrative in our state and to show that early literacy starts much earlier and that we need to support families and caregivers from day one. And so thanks to that big policy push, we were able to secure 10 million specifically for our Birth to Five literacy work, which was a huge win in our state for infants and toddlers that often get left behind. All right, so next slide. In closing, just quickly to wrap up and summarize, we made a big investment in early literacy, and that initiative is really focused on equity, family engagement, and culturally responsive research-aligned strategies. And we also had the opportunity to pass Senate Bill 141 to ensure that that literacy investment leads to real measurable outcomes. So it's adding to our accountability infrastructure, setting clear expectations, tracking progress, and supporting districts to meet their goals. So these two policies work hand in hand. One is providing the resources and the vision, and the other ensures that follow through and support. So together, they're reflecting Oregon's commitment to transparency and continuous improvement in early childhood. And we know that the passage of these policies is just the very beginning of this work. And the effective rollout and implementation is going to be critical, as you just heard from Louisiana. And you're also going to hear from my colleagues from Arizona and Hawaii next. So with that, I'm going to pass it back to Steph. Thank you.
Wonderful. Thanks, Marina, so much. I really appreciate the journey that you've been on. And I think it's really so important for Oregon to be on this call as we think about what it means to take a hard look at where you are and where you want to be, and then to get the coherence that you're really looking for. So really appreciate that story, and congratulations on the bill and the support from the governor. So we are going to turn it over to Lori Masur next from Arizona, from Read On Arizona, to talk about their journey in Arizona.
Absolutely. Thank you, Steph. Happy to be part of the panel and share Arizona's story. Next slide, please. So just a little bit of level setting for you guys who may not know who Read On Arizona is. We are our state's early literacy initiative, and Steph alluded to this earlier. Along with Hawaii, we do adopt and implement a collective impact model framework in order to do the work that we do. And we have a very strategic focus on improving school readiness in third grade reading. At Read On Arizona, we often say that it takes 8 years to build a reader, so we should really be paying attention to what happens in the early years and in those early grades. Next slide, please. So one of the things that we want to emphasize and share with you all is our Arizona Literacy Plan 2030. As many of you guys know, every aspect of a child and a student's life is impacted by literacy. And partners in Read On Arizona came together to develop and launch the Arizona Literacy Plan 2030. And this plan, as you will see, really outlines the actions and the proven strategies and really the commitments that are necessary to really be targeted and address school readiness and improve literacy outcomes. And so the action plan that I'm going to share with you guys is really the result of over 12 months, probably in between 12 to 18 months of Read On gathering input and commitments from state and local partners on how to align efforts and to collaborate over the next 5 years, but really beyond the next 5 years and beyond. And it really is designed to help us focus on what's working and build momentum towards the results that we know that our students in Arizona deserve. Next slide, please. So partners in Read On have agreed and determined that these 4 key drivers that you see here on your screen are critical to moving the needle and ensuring that all children are reading on grade level. And you'll notice that in that bottom right-hand corner is expanding access to high quality early learning. And that we know that we really need to think of these key drivers not as a menu where we're sort of cherry picking, oh, we're going to do evidence-based solutions and we're going to do building educator capacity. They really should be viewed as a recipe. All 4 of these key drivers need to be used in tandem at the right dosage with the right frequency, really based on the context of your state in order to produce the results that we want to see. In the state of Arizona, we do have a progress meter goal as part of our Arizona Educator Progress Meter that says that by 2030, that we want to see 72% of our children reading on grade level, even though we know that research tells us that 95% of children can read on grade level when given the right interventions and supports. Next slide. So we know that I always like to say we can do anything, but we can't do everything. And we really shouldn't be doing just anything. And so some of the strategies that you see here, we have those in place in Arizona. And we've seen these strategies be implemented in different states that have been seeing progress. Louisiana, who presented earlier, they saw progress on their NAEP results. We've also seen some progress in Mississippi and Tennessee, sort of what Arizona refers to as the Southern Surge. Even though we have those strategies in place here in Arizona, we're not doing them to scale. So they are in progress. It's sort of like when you think about progress loading. So we're on that pathway. And as you can see here, increasing access to quality early learning opportunities is one of those key goals. Louisiana talked about the early childhood governance structure, earlier, and similar to other states, the early childhood governance structure in Arizona is decentralized across multiple agencies. And I want to say, however, and a big however is those agencies, those state agencies who are responsible for the governance structure in Arizona for early childhood are all partners in Read On Arizona, and they actually serve on our advisory board. And they are all committed to a common goal of expanding access to quality early learning. And this has been reflected in working collaboratively on federal grant opportunities. And in recent years, we've seen many attempts to to institute early learning funding into our state budget. Next slide, please. When we talk about that common goal, right, everybody in the same boat, rowing in the same direction. Our common goal in the state of Arizona is we want to ensure that our preschool age children have access to high quality early learning settings. And that statewide goal that we have is 45%. We know, and I'm sure everybody on here knows, that vocabulary use at age 3 is a very strong predictor of reading comprehension in 3rd grade. And so we want to work collectively and collaboratively with our partners to ensure that we are meeting that goal by 2030. Next slide. So that gets us to the partner action commitments, where we are talking about how do we work across state system partners, local partners, and community partners, all about how do we scale up that Scale to Succeed strategy? How do we all work in alignment to ensure that we have, we hit that goal in 2030 of 45% of our children in those high quality early learning settings. And like I stated earlier, the plan is really designed to help us focus on what's working and build momentum towards that. Next slide. So what I want to share here is actually just a very high level overview and a sample of those partner commitments, which is what you see here. You're able to access the full literacy plan at the Arizona Literacy Plan 2030. And that site actually provides a robust overview of the plan and the call to action, and includes the interactive partner action commitment portion. What you see on your screen here is that interactive component, where you can see that it's been filtered down to the high quality early learning. And from this sample, you can see the commitment across state partners and local partners. You can see that our Head Start Collaboration Office has included increasing access to high quality early learning as part of their 5-year state plan, and working in collaboration with Read on Arizona to do that. The Department of Economic Security actually oversees our state's Child Care Development Fund, and you can see just one of the contributions that they have outlined is the Professional Career Pathway Project, which supports early childhood educators in our state. The third one is from our Birth to 5 agency, First Things First, which just one of the things that they oversee in our state is our state's quality rating improvement system. So again, these are just one of their contributions to that. And then Read On also has a network of over 20 local Read On communities, and each of those local Read On communities is committed to advancing the priorities of the state level, and you can see what they have committed to there as well. Next slide, please. So what does that look like over the next 5 years? Next slide. So as you can see, we start with the launch of our plan with 2030, and some of those critical milestones that align to those key drivers are indicated here. But on the next slide, you will see that, next slide, please. In the state of Arizona, we do have a goal that by 2029, we will identify additional investments in order to help us reach our goal. Next slide. So this again is just the location of our literacy plan, so you're able to look at it in full and interact with it. And on that, I'll go ahead. I know we want to hear from what's happening in Hawaii, who's also doing great work with Collective Impact.
Wonderful. Thanks so much, Lori. This was fantastic. All right, I'm going to turn it over to Carrie Urosevich. She's based in Hawaii to talk about their story.
Yeah, aloha mai kako, and thank you everyone for joining us. What a pleasure it's been to listen to the panel members and to hear about all the great work that's happening across the nation. It's been really exciting for us over the last decade and a half to just see young children become a priority. And we've been able to see many great examples. So I'm Carrie Urosevich, and I'm the Executive Director of Early Childhood Action Strategy and the State Lead for Grade Level Reading. We are in our 13th year as a Collective Impact Initiative, working on these 4 goals. That more of our babies are born healthy, that more of our children in Keiki are safe and healthy and they develop to their full potential, that children are ready for school when they enter kindergarten, and that children are thriving by 3rd grade. We do have a heavy focus on sequence, duration, dosage, and the right kinds of services and programs. We're organized among 300 of our government and non-government partners across 10 teams and multiple sub-teams. And we have a backbone organization that's made up of 12 staff we call ourselves the Grout. in the system. And so we help support those teams, and they're all working on different parts of the early childhood system. We have 8 main islands in the state of Hawaii, 7 of which are inhabited. We do not have a ferry system, so you can imagine how difficult it is for our rural communities on our neighbor islands, not Oahu islands. And so we try really hard to make sure we're looking at equity, equity for our rural communities, and then equity for our families that are struggling the most. So we wanted to share progress that we've had over the last 13 years. So next slide, please. So if you look at our breastfeeding rates, all of our breastfeeding rates are going up. Our ever breastfeeding, our 8 weeks, and then our 6 months. We're really excited about that. Our hospitals have done an amazing job of being more hands-on and making sure that we are getting the lactation support that our families need. The next one that really excites me is the flourishing on all 4 items. So if you know the flourishing scale, we went from 64% to 78%, so a pretty significant jump for our children birth to 5. Next slide, please. Our child abuse and neglect rates continue to drop, which is really wonderful also. We try to make sure that we're looking at the whole child. We know that children that are living in homes that may be experiencing family violence or homelessness, or some of our really key ACEs, they're going to have a hard time learning. So you can have all the preschool access you want, but if those kids are having a hard time at home and don't feel safe, that's going to be primary. So our CAN rates are dropping. And then our 3rd grade proficiency, we are doing so well. We are continuing to increase. The pandemic hit and we had a pretty significant drop, but I'm just excited to share that we are back up to just above where we were pre-COVID, and grateful for our Department of Education and all of our partners, our nonprofit partners that really stepped in to support. Where we have, and some of our other indicators that I think are important to share is our public pre-K program that started in 2014, and I'll share more a little bit later. They met all 10, they're one of the 5 states in the nation that met all 10 near quality indicators. And so we've worked really hard to make sure that our public pre-K program is high quality, and that will definitely have benefits. Next slide, please. We use the 6 conditions of systems change in our work. So we make sure that we as a network are working on policy, that we are supporting and scaling innovative practices. We're increasing investments for our youngest keiki with a real focus on prevention at the state level and at the county level, and even with our philanthropic partners. That we're strengthening cross-sector leadership, we're improving alignment, and we're shifting awareness, narrative, and culture. So I wanted to share specifically about 3 projects as an example of how these systems change efforts play out. So next slide, please. So the first one is our Makua Allies program. Makua means parent. And one thing that our network does is we incubate potential solutions. We test to see if they will work, and then we figure out a home for that program, and then we work to scale. And so the Makua Allies program we incubated it to support pregnant women experiencing substance use disorder. The goal was to keep mom and baby together through treatment, and for mom to complete treatment and to thrive. And one of the most important ingredients of this program was the peer support specialists that come alongside mom while she's navigating the treatment program, while she's navigating services, while she's navigating childcare. And that ended up being really the secret ingredient. Out of our 35 participating moms, only 1 baby spent time in child welfare, and that was because that was mom's choice. All other babies stayed with their moms, which was amazing, and all moms completed treatment. And this project is a great example too of government, non-government partnerships, because it's required Department of Health, Medicaid, many of our nonprofit organizations, our substance use treatment programs, to intentionally collaborate and then to pass some legislation to support peer support. The second one is our Executive Office of Early Learning Public Pre-K program. And our lieutenant governor committed 200, I should say our state, via our lieutenant governor, committed $200 million in public preschool facilities. And I heard some folks mention the challenge: if you don't have facilities or you don't have staff, you don't have a program. And we set a goal for universal access for all 3- and 4-year-olds to have access to high quality preschool by 2032. And I'm really excited to share that the state is on target to do this work. And we couldn't do this without the Executive Office of Early Learning, our development partners that are helping build the classrooms, our higher education partners who are creating the pathways for workforce, our charter schools, and then our private providers. And then the third example is around alignment. So we have what are called early childhood continuums that we're piloting in 2 of our rural communities, one on Oahu and one on Hawaii Island. And it's looking at how do we intentionally connect programs and services from prenatal to age 8 for families so that they get a warm handoff between programs and that families don't drop between the programs. And it's a no wrong door approach. So wherever, this is called an Hawai'i, which is a system of when the water comes down our mountains and it goes through multiple lo'i patches and then it goes out to the ocean. That's what we want for our families, that they have these handoffs to each of the lo'i patches so that when they hit the ocean, they're free to sail. And so we want to make sure that no matter where they enter the system in their community, that they are connected. And this is really important for Hawaii because our communities are so diverse. And so when we talk about designing the right type of program for the families that live in those communities, it doesn't help us to take national best practices oftentimes because we have so many families from the Pacific Islands. We have a host culture, a Native Hawaiian host culture. So our Native Hawaiian immersion programs are critically important. So really making sure we're tailoring at the community level and the community themselves are designing those early childhood continuums. So I just want to thank you all and look forward to the questions that might emerge in the discussion.
Thank you so much, Carrie. Beautiful. Just wonderful to hear about all your progress. What we're going to do now is actually have a chance to talk with our panel members. We have a couple of questions teed up for you all, and then we'll take some audience questions. Although I noticed in the Q&A that a number of you have already answered audience members' questions, so just appreciate that. So if you haven't checked back in the Q&A, please do that and see if your question's already been answered. So I just wanted to reflect on the conversation so far today. I mean, I think what's been really beautiful to see is all of the different design elements that you all are implementing. I mean, I think of Nasha and Jen and the work in Louisiana that's really so grounded in partnerships and then smart design decisions around the focus that you were going to have. And then seeing Oregon take on sort of this next generation of accountability and understanding that you really needed to get to the coherent kind of approach that you needed, that you wanted, rather than where you had been. And then you're working to implement that. I thought it was just incredible to hear about Arizona and how the literacy plan just drives the work forward. I think that's just incredibly helpful to have 5-year goals and sets of goals that you're trying to meet as you go. And then similarly in Hawaii, having oriented around a set of 4 goals and then structured the work to move that forward. Although I just was surprised by the strength of the grout in Hawaii, because I mean, having 300 government partners and having the backbone organization at the level that it is really incredible. So just appreciate all of what you've brought to the table. So we have a couple of questions that we can dive into together. I think one of them is about scale. And I noticed as people were talking, people are at very different stages of sort of long-term implementation or trying to get to scale or sort of dealing with a new legislation that you're trying to get off the ground. So I'm curious what you all have found to be the most effective strategies for making this work sustainable and scalable in these days.
One thing I would say is, number one, we start with an assumption that we are going to reach scale. So we never start with design that's only meant to reach a certain population of kids with the hope that it will eventually reach all kids. We truly start by thinking about the entirety of the early childhood system, the mixed delivery model, and saying if we want to get to 100% of kids, what will have to be true? And then work backwards from there. A second thing, your second question was about sustainability. The Louisiana work is now over 10 years old, which is just really exciting. The thing that made this work sustainable was the partnership with localities. There are more champions in Louisiana for early childhood work than any one state government employee could have made. They are in every part of the state, in the backyard of every program. That is what sustains the work. And I think it really matters that, as Jen spoke to, there was like a state plan, a set of things that were true at the state level, and a lot of flexibility to make it possible at the local level, because East Carroll Parish is not the same as Orleans Parish. And then the last thing I would say about making it scalable is collecting data, and not being so wed to the perfect data metrics on the perfect kindergarten readiness assessment or the perfect way to do child counts. But, we gave our local lead agencies these really complicated Excel spreadsheets, and they completed them. And that's how we knew how many kids were being served by public funds. And without that kind of information, we never would have achieved scale.
I think someone in the chat asked about measures, and so I think you answered that one, so that's good. So look to that answer too. Other thoughts around scale? I think Lori, you had mentioned that as you were speaking, so I was curious.
Absolutely, and I 100%, agree with Nasha, right? We have, what we know is possible, what the data and research tells us is possible, and then really taking this collaborative all hands on deck approach, and also having partner agencies at both that state and that local level committed and resolute in making that happen. I think the other thing that we have to think about, because I think when I saw the comments and questions coming in, is everyone has concerns around funding. And I think from the jump, Nasha and Jen established that funding is always going to be, our biggest barrier. It's always going to come up. I don't think it matters what year you're in, what state you're in, where you're at in the local level. And sometimes when we think about sustainability, sometimes we need to think about sustainability in terms of program design, and not necessarily sustainability in terms of just the funding. When we commit to saying, well, what does, as Carrie talked about, high quality early learning, we talk about high quality early learning. Like, if we have agreed upon definitions of what high quality early learning is, and what we want for the workforce, what we want for children, and what we want for families, and we hold to that design and we sustain that design, that's, regardless of the ebbs and flow of funding, I think we have to think about sustainability and that capacity too. We know what works for children and families, and despite how funding flows in, we have to be committed and resolute to holding to that design and not compromising on that design if funding happens to drop. So all that to say, like I said, sometimes the sustainability piece is not just in the funding levels, it's about in the design of what you want to see for children and families and for your workforce.
That's great. Thanks, Lori. Anyone else want to jump in?
Sure. I mean, I'd love to piggyback on everything that's been said in terms of, I really agree with the design piece, and, starting also with a really strong vision of whole child, whole community vision. And we just have, if we want early learning to scale, we're just going to have to stop thinking about it as a siloed, system, and treating it as the foundation of everything else. And so one of the things that we've been lifting up and talking about is really early childhood across all systems, pushing for cross-agency collaboration at the state and local levels, so that when people are thinking about, or the governor prioritizes housing, we're saying, think about kids in your housing design, think about kids, and building childcare infrastructure within our housing build out, think about our workforce and our public health strategies for kids. And then another big piece that we've been doing for several years now is really partnering with K-12 as co-owners of early learning. And I mean, we have to have K-12 systems seeing early learning not as someone else's job, but as critical to their own success. And when we've kind of shifted really partnering with them on policy and strategies, that's really helped us to build that shared accountability and data systems, because they just have more power in our state capital and they have more resources in early childhood. So we've found when K-12 leaders really understand that third grade reading starts at birth, we're starting to see more alignment and more investments. And then I'd finally just say, like, we just have to continue to invest in that infrastructure and not just programs, and avoiding those like one-off pilots. That goes back to that design, like starting with sustainability and scale from the outset.
That's great. Thanks. Carrie, do you want to jump in?
Yeah, just to add to, I echo what everybody else shared, and then would just add, I really appreciated whoever said on the panel, and sorry, I didn't write it down, but that, young children and early childhood development, these are essential services. We like to say they're basic infrastructure. And even with the federal mayhem and everything that's happening, we have to unapologetically continue to advocate for our youngest, because we've seen, right, a decade ago, they would just easily get pushed right off the plate. And so continuing to talk with our business community, our different state departments, our police force, our fire folks, everyone needs to care about our youngest, and our young families. And so we've been working closely with our employers, to have them be champions. So there's that piece. I think the second piece around sustainability is the being in it for the long game. There's going to be dips based on political leadership. There's going to be dips based on funding, but really finding those that can invest in the long game and have that long vision. And then when times are tough financially, hyper focusing on what's most important for the most vulnerable. And then when the opportunities come again, you can, widen back out. So it's a dance. I think it has to be adaptive.
That's super helpful. So I think I'm going to transition to the next question. You all have presented incredible successes so far. And also, I do acknowledge, Carrie, your comment, and Lori's too, that, this has been a long journey. You've been here for a decade or more, and Marina and her team have been there, in Oregon doing work and advocacy for a long, long time. But you've been incredibly successful, particularly recently. And so I'm curious what you think are the biggest barriers to advancing this work. You've named a couple, like, funding and those kinds of things, but I'm curious if there's other that you want to sort of pass on as people think about how to do this work together.
I'll add one, which is, this is still a very nascent, early kind of genesis of this work. And so in some places, you tend to want to see how it's working in other places before you implement locally. And in some cases, you're not going to be able to do that, right? Because this really is vanguard. If you think about the field of early care and education, while child development is infinitely old, our study of it has not been, right? And so many people spend a lot of time thinking about what's happened and worked in the K-12 system, and then try to kind of right size that to what should happen in the ECE system. So I think that some of this is around the barriers, is convincing folks that, some of the information that you're going to have to rely on is not going to be tested yet. And just being comfort with having some comfort with some ambiguity. The second thing that I might offer is capacity. I cannot express to you how hard this work is, and dedication of the teams that is required, and how you have to rely on partners kind of all reading from the same playbook to reinforce each other. I think that's one of the real success stories of the work in Louisiana is knowing there was always somebody else who had their foot in the work just as much as you.
That's amazing. Anyone else want to talk about the barriers?
Well, yeah, and I think, I think Carrie was also going to chime in, from a collective impact model perspective and having, been in it for a while, Jen, I 100%, agree. When you're sort of in it for the long haul, you kind of see the ebbs and flows. What I would say is probably one of the biggest barriers that we have seen is not necessarily a funding piece like we've discussed, but sometimes it's the turn and churn of people in leadership roles at organizations. So when you operate in that collective impact model space, it's the organization that is at the table. And when you have leadership in those organizations leave, sometimes there's this onboarding piece that has to happen, and having people also buy in at the same level as their predecessor into the work. I think we can't discount historical context and historical knowledge of the systems at play, even at a federal level down to your state level. And sometimes it's about, you have your partners in the boat rowing in the same direction. And some people have heard me say this beforehand. There are sometimes when you have to bring that new person up to speed and hold on to their oar for a little bit when they're when they're in your boat, so to speak. But I sometimes think that happens to be a barrier, is just some of the leadership and the turn and the churn that we have in those roles, and keeping them sort of in their lane, in their space, continuing to push the work forward. And then to Oregon's, piece, earlier, champion across the entire system, that early childhood is not this separate thing that exists out here. We often talk about the early childhood ecosystem. To Marina's point, really is just the education ecosystem of which early childhood sits within. It's not, and it should not be, viewed as this entirely separate, entity and piece.
That's great. Someone in the chat said they appreciated the churn and burden comment, that they had experienced that as well.
And Lori, I'll take your boat metaphor and turn it into a surfing metaphor. And we learned the hard way to not invest solely in our State Department directors because they turn quickly and they turn with governors. And so we started to really invest in our middle management. So our branch chiefs, division directors, who, many of them are in it to retire. And so, this work moves at the speed of trust. And when you can deepen that trust with your state partners and with your nonprofit partners that tend to not move as frequently, that has helped us a lot. It took us years to learn that. That was a game changer. And then from a surfing lens, our big wave surfers wait for the big waves. And they are so happy when they come in. And so we're always looking for our big waves of opportunity. And so making sure we're paying attention and we're looking forward at what could be happening. And then if it does happen, whether it's a political change, it's a State Department leadership change, it's a state priority that is shifting. For right now, with the federal challenges, we are looking at, is this the opportunity, since everything is chaotic, do we now centralize our early childhood work under one house versus having it split across our state departments? So what is that big wave opportunity that we can all ride?
That's great. Love that. Anyone else want to jump in on that question? Okay.
I mean, I think a lot of it has been said, but in Oregon too, I'll, someone in the chat had said that there's no investment in universal preschool in their state, and that, is a huge challenge in Oregon, but we're also limited by some of the other challenges that have been brought up. Our workforce capacity, we have to build that up simultaneously. And then the other big piece is just lack of facilities. And I know that also comes back to funding, but those two, I would say, are the big pieces that are constraining our ability to scale early childhood in our state. And then also assessments. I know that also came up as a question, but we're continuously grappling with there is no singular tool. Local people have adopted assessment tools at different times. So we've been working on what is the expectations and guidance around assessments, as opposed to providing a singular tool. But I do hope that we would try to get there at some point, because it's really hard to have, different local entities with different data. So it's comparing apples to oranges in a lot of cases. So assessment continues to be a challenge.
Yeah, that's helpful. Thanks for sharing that. I wondered where you were on that, particularly given the accountability part of the bill. I thought maybe I'd pull out a couple of things that you all said that were important and just have you reflect on them, because I think they might be good lessons for other states. So for example, Nasha, I was thinking about I'll name them all, and then hopefully you can just go through them. One is the pilot year, I think, is an interesting strategic decision to get it off the ground well. So I wondered if you could comment on that. In Arizona, Lori, I wondered if you could talk a little bit about your comment about you can't just do anything, and how do you sort through your options to get to something that you think is really going to move the needle in your state. Let's see, for Marina, I think I was kind of wanted more on the coherence question, because Oregon's had a long history of doing work in early childhood. So then how do you also shift the narrative of like, we're not where we want to be, and then we need to do these changes that are going to make a real difference. So I'm curious about how you can make that move. So we start there, and then we can add more comments as we go. Nasha, then Lori, then
yeah, I can go first. So I think part of that pilot year structure, again, we never when I say again, to go back to this idea of you start with 100% in mind, it was never a pilot as an initiative. It was always a pilot to scale. It was always, we are doing this in 3 years to get to 100% of communities who wants to opt in first. And I think that matters. I think that I know that there is, from working with a lot of states, like initiative fatigue, pilots for the sake of pilots, something peters out and doesn't happen. That feels very complicated. People are trying to get their marching orders from states. They're trying to understand, what should we be prioritizing? How can we partner with you best? And I think it's essential to be building those kinds of pilots with a plan for scale in mind. And that was a really important part of the pilot. And we piloted so that we could work with the folks who were ready to sign up and say, like, yes, I want to figure this out, and showed up as partners in the work. I think that it was not easy. We learned a lot. We changed things over time. We fixed as we went. We started with a working hypothesis that wasn't always right, but we still knew that the thing we were piloting was going to get to scale, even if the specifics of how it got to scale might change as a result of the pilot. And I think that approach was really important.
Super. That's really helpful. I just appreciate the sort of honest answer around like, you had to pivot. You thought one thing, it really was another, but like, that's the value of your scaling plan. So, Lori.
Yes, happy to chime in on the you can't do anything. I think this is where, and I think hopefully the panelists and others will appreciate that we've had decades of research in the early childhood field about what works when it comes to, systematic explicit instruction for young children. And I think sometimes people don't realize that the learning that happens in early childhood settings can be systematic and and explicit. So we've had decades of research that tells us what works as it relates to effective instruction, what should happen in environments. We heard Louisiana talk about their simple class and how they use that to assess. So we've known for a while sort of what the key ingredients are. The other thing I will say is that in Arizona, we do, despite, our governance structure being across multiple agencies, for almost a decade now, we have had an agreed upon definition of what a quality early learning setting looks like in the state of Arizona. And so for us, we know that those settings they're Head Start settings. They are settings that are nationally accredited. They are settings that are overseen by our state Department of Ed. In addition, I mentioned First Things First, our Birth to 5 agency. They oversee our state's quality rating improvement system. So you have to, be quality rated or higher. So we have this agreed upon definition of what that looks like. There also have been efforts underway for over a decade around how do we support the workforce? What does a well-compensated and educated workforce look like. We put those standards in place back in 2013. So I like to say we've had these stepping stones in place, right? So we've had, you know, an agreed upon definition. We've had supports around what does you know, the workforce look like? What do environments look like? When we bring those together under one umbrella and we ask partners to say, of what you are doing, what is your contribution to the greater good in order to get us to that 45% and beyond? And they contribute those action commitments and then say, this is the progress indicator on them. We're going to annually measure this progress indicators. I saw that as a question in the comment. Sometimes progress indicators are not just child outcomes data, which is what Louisiana alluded to beforehand, right? Sometimes it's about, you know, how many children we get in the setting, how we're supporting the workforce, or things to Marina's point in Oregon, legislative things that have come underway, investments that have been made, Carrie's 4 goals that she talked about, and how they're structuring, you know, the work. I say that because the work has been underway from some time, and we have to lean into what the research tells us works when it comes to environments and effective instruction. And again, we have to get resolute. We have the design, we have the blueprint, we know what works. It's about implementing that and implementing that to scale. And that's why I say we shouldn't be doing anything. We know what works, and we have to, and I'm going to borrow a quote from a colleague, we really have to get really dogged about and resolute about closing the gap between what we know works and doing what works.
That's super helpful, Lori. I think one of the things I wonder about is I think when we did our prep call, people talked about the different recipes, right? And there are some different ingredients, but it sounds like you really feel like you've got the ingredient list down in terms of where Arizona's going. But I'm curious, actually,
And that
Carrie.
quote is not my own. That quote actually comes from Dr. Noni LaSalle when she was speaking to a group of Arizona education stakeholders. So I want to give credit where credit is due on that piece.
Okay, that sounds good. Carrie, do you have any reflections on what Lori said?
Yeah, I would just add it's a yes and, because we do know it works. And I think we're still discovering, because we're doing a much better job of centering children and families in the decisions, I think, than we used to. And looking at what I would say promising practices that are really showing impact in communities, and doing what we can to scale those and shape those and frame them for funders so that they see that we don't always have to go back to the national list, because the national list isn't always what our communities need. So there's a yes and in there.
Awesome. Thank you. Marina, I think I put you on the hot seat next, and then I
Yeah.
might do a lightning round to wrap us up.
I just, you know, go back to what I started with in the beginning, was that our abysmal test scores really were a wake-up call for Oregon. And even though we as an organization have been saying over and over again, we need a more robust investment in early childhood and early literacy, we know what works, just like, you know, what Lori was saying, we have the recipe for what can work, and we have been pushing a rock, a boulder up a hill to get that message across. And so the NAEP test scores really kind of helped push and propel, thank goodness, our legislatures to really pay attention and recognize that what we've been doing, a fragmented system, is not working for us. And so we do need to bring coherence to this and more intentionality. So we're doing it, and so we'll have to report back in a couple of years on what we're finding, and hopefully we'll be shifting the trajectory.
Wonderful. Thanks, Marina. So I'm noticing that a number of the questions in the Q&A have been answered. So I'm actually going to do our last question. And it's appropriate, I think, to end with families. So one of the questions we had talked about was sort of your reflections on how you design with end users. And I think of families as one of the key end users, but you have others as well. So wondering if you want to do sort of a quick lightning round around how you think about that from a design perspective.
Yeah, and I go back to how I started our presentation, which is to really rethink of the system as a mixed delivery system. Kids and families find programs or sites or centers with seats that work for their needs that are in their area that are affordable. And so when I think about how to design and build an early childhood system, I really try to center that experience and making it as easy as possible to help families find the option that will work best for them so that their kids enter kindergarten ready.
Wonderful, thanks.
And in Oregon, I would just say that, you know, we've really in the last few years tried to keep the end user, families and educators at the center of everything we do. And so our organization serves as the backbone for our state's early childhood coalition. And we didn't always have a coalition. But we've grown that with a lot of partnerships, and we're really committed to inclusive policy making and meaningfully engaging the people that are most directly impacted by our public systems. So really listening to educators and classrooms and families that are navigating care and providers running programs to really help inform our policy advocacy efforts.
Great.
I'd say it's part of our DNA and part of the work that we do. So that's both formal and informal. So in the formal ways, we have always created a seat and we have formal representation on our governance bodies and do formal surveys, blah, 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 right? That is always where we've started. But the informal, I think, is even more important. And so we actually kind of have a warm line. It's not a hotline, but a warm line where we find that providers and families will call us all the time, and we ensure that that information gets integrated into decision making at any point, in addition to like doing the work of, structured kind of family and provider engagement work.
Super. Thanks for that distinction.
Yeah, Jen, I just made note. I like that warm line idea. Although I don't know how I'd staff it, but I like the idea. I'll figure that out later. We same thing. We've built it into our DNA and have increased it over time as we've learned, and really trying to make sure it's meaningful. We do pay families to participate and sit on community-based panels that decide what the priorities are for their community, and then they also decide where the money goes, which has been really fun to watch and experiment with. And then we pay families to participate on our 10 teams, but for meetings that matter. Right? Some of the meetings, if I was a family member, I wouldn't want to be sitting in that meeting. So just making sure it's hyper meaningful and it's at a time that works for them. And we're continuing to learn and strengthen in that area.
Wonderful. People should reach out for you for that.
I'll just add one thing onto that, so I'm not duplicating some of the other things that some of my colleagues have said, and really give a shout out to our local Read On community. So Read On Arizona serves as the statewide early literacy initiative, but we do have a network of over 20 local Read On communities, and with some of those local Read On communities, family members sit on there right alongside school districts or libraries or even some of their state legislators. In addition, we have Read On communities that operate regional family engagement literacy hubs. We call it Project FELT, Family Engagement and Literacy Together. And so it really is an opportunity for families to come and learn about how to support their child, be connected with resources within the community. And they each look different based on the region or community that they're in, because we allow local Read On communities to define what their community is, whether or not that's a city or a couple of zip codes or a county level. They design that to meet the unique needs of their particular communities. Like we've heard, I could go to the northern part of my state, it's going to look different than the southern part of the state, and so are the needs of the families, students, and children there. And so I think our local leads have been very responsive to the unique needs of their families and their students.
Wonderful. Thanks so much. Appreciate us ending with the people we're designing with and for. So I'm going to say one thing about the poll. I think there was a poll that popped up, so hopefully you've had a chance to answer that. And then I'm going to turn it over to Jenny from the Campaign for Grade Level Reading to close us out. But I also just wanted to thank our panelists. If we were all in the room with you, we would be clapping. And so I just wanted to thank you for all of your great insights, and just appreciated being able to be part of this panel with you.
Thanks so much, Steph. And I'll add my thanks to our amazing panelists, Nasha and Jen, Lori, Marina, and Carrie. And Steph, thank you for being our for being our amazing session grout. It was a wonderful conversation. I'd like to just turn people's attention. I've started to post some of the links to the GLR week sessions that will continue the rest of this week. We have one this afternoon that will be focused on tutoring, the tutoring workforce, and then additional ones on chronic absence, rural issues on Wednesday, and on Thursday, elevating the prospect of Alice families and parents as curators of their children's education. So lots of great topics coming up. The previous slide that I skipped over, I did want to acknowledge, especially because we have some amazing state folks on this call. Throughout the network, our state and community leads are hosting events as well during GLR week. And so we would invite you to go to the website and get a sense of what's happening. Some of them are webinars that you can also join, and some are local events. So please feel free to check those out as well. And then, as we said at the top, we'll have more webinars, the rebroadcasts happening in August, as well as live events, webinars that will happen starting up again on September 2nd. So be sure to check those out, and we'll hope to see you at another webinar this week. Otherwise, have a great afternoon, everyone, and thank you so much again for joining us.